a brief introduction, get some basic information out there. There's some photos and so forth. And then write down your questions, ask your questions as we go along, or we could do it all at the end. So I'm a facial plastic surgeon, board certified in facial plastic surgery. Please no photographs or video. These are our social media. I have no financial relationships with any of these companies. Some physicians do. A lot of what we do is off-label. I don't know if you're familiar, but the FDA may approve certain products or materials for specific uses. And a lot of what we do is really off-label. For example, they approve an injection here, but we're doing an injection here. Okay, we still do it safely with a medical, sound medical approach. And this is all education and opinion. So there are many choices with fillers, and fillers are just soft gels you can inject. People are injecting fillers everywhere in the face, and even the body for that matter. My main recommendation is never inject anything that's permanent, such as silicone, because if there's a problem, you cannot get rid of it. It's almost impossible to get rid of it. They are all temporary. On the shorter end, 1 to 3 months. On the longer end, a year, 2, 3 years. They're all synthetic. They're all made of primarily hyaluronic acid. There are other materials, such as Sculptra or Radius, that are made of different materials, but this is focusing on hyaluronic acid fillers. And there are different brands. I'll show you all the brands. And they vary in thickness or strength, how soft they are, how loose they are, and as a result, how much water they attract from your body, and how long they last in the area. Do they provide just softness to a line or fold, or do they provide some structure? And the last I checked, these are all the brands, and these are U.S. names. So Allergan creates Juvederm, Galderma creates Restylane, and each of these have sub-products. Outside the U.S., they may have different names, but more or less, these are all the. And we have a variety of the fillers in the office, and most offices do. And we mix and match based on the patient, based on the location that we're treating. And the method we do, sometimes we'll use a needle, but oftentimes we'll use a cannula. The tip of it is blunt. It's generally safer, less bruising than using a needle. But there are downsides. Okay, I'm going to first go through the downsides, and then we'll talk about the benefits. Because even anything, even Botox has some downsides. The main one is swelling. Okay, but the others include migration. It can move. You inject the lip, it moves a little bit off to the side. Autoimmune, we'll get into in a second. So swelling, there's both acute swelling, delayed swelling. So acute swelling, this is what happens within the first few hours a day. After any treatment, it takes about a week to 2 weeks to settle. You see a result right away, but it's not the final result after about a week to 2 weeks. But you could go out in public after a few hours the next day for most patients. The main issue is delayed swelling. You could be fine 6 months later, 1 year later. Your body's immune system is flared up for any other reason. In areas where you have filler, they get a little puffy, a little swollen. Okay? It's more of a cosmetic issue, but especially around the eyes, that can be an issue. Migration, we talked about, and they've done studies. So some women who had their lips injected had skin cancer somewhere around the lip. They take the skin out for the skin cancer, and they saw filler in areas that were not injected. So there is some movement. Now, it's not going to go from your chin up to your forehead, but usually around the area. And usually the lips, because the lips move. The autoimmune issue, so this is, fillers are considered an implant. It's made of hyaluronic acid. Your skin has hyaluronic acid, but it's synthetic, and it has some other things with it to put in your body. And some patients, it's rare, it's case reports, it's not very common, induces an immune reaction in you. And that could present itself as redness, as itchiness, as swelling, as all kinds of issues. So, and it's hard to diagnose because it can happen years later. Okay? More common things are nodules. You inject it, and your body attacks it right away and creates a little bump, either acutely, and usually these are treatable. You could give it a little antibiotics, a little massage, and they usually go away, or we'll just stick a needle in it and squeeze it out. Infections, again, because it's an implant, fillers are implants, a soft implant, but it's an implant nonetheless, and it's going through skin. Your skin is, no matter how clean we do the procedure, it's never 100% sterile. And even if it was sterile put in, there's always some bacteria that's circulating in your blood. And sometimes it will stick to the implant wherever it is in your body. Fortunately, I've never seen any of these issues in our office, but I have treated it. And most infections from fillers are pretty treatable. The main issue, now the next two topics are a little scary. And I'll show you some pictures that can be a little alarming. One is necrosis, the other is blindness. So there are a lot of blood vessels in the face. And when we're injecting it, sometimes we'll do a needle, but most of the time we'll use a cannula, so the tip of it is blunt, so there's less bruising. But there's a chance that the material gets into the blood. And as a result, you lose blood supply to the area that artery fed. Most of the issues with necrosis tends to happen near the center of the face. The farther you get out of the center of the face, usually less issues with necrosis because there's a higher density of blood vessels. And usually we'll see it right away. Again, I haven't seen it in my office, just the techniques we use, but I have treated it. And here's one example. I don't know if you can see, but in the center of her forehead, it's very red and tender. So whoever injected her, they didn't recognize it or ignored it, and she came to my office. We treated it. Thankfully, I saw her a few hours after treatment, so there wasn't any long-term problem. Here's another patient. If you can see, the whole dermatologist injected his nose with filler, and the whole nose changed color. That's a sign that, again, the blood vessel was affected, and there's decreased blood supply to the tissue, and it has to be treated right away. I consider it like a heart attack of the skin. You gotta treat it right away. Here's a woman who came to me one day. She was out somewhere in Maryland getting treatment. And again, 99% of the time, no issues, but she was an unfortunate one, had an issue, came to see me. And it's just a day later, so that skin is already dead. And I had to do things to try to get it along. Now she's pretty good, but there's still some scar tissue there. Okay. And we treat it like we treat a heart attack. We try to improve blood flow. So we'll use aspirin, nitroglycerin paste, hyaluronidase to dissolve it, heparin, a lot of medications to improve blood flow to the treated area. Okay, here's some. This is from a research article. We see a lot more in Asian countries because they do a lot of injections around the nose, and again, any injections around the nose tend to have more issues. Okay. So blindness, it can occur. It's very rare. I've never heard of anyone in the DMV area have blindness. Right? You're running. Why even sign up for this filler? Craziness. All these dots represent case reports of a filler injection that resulted in blindness. So most of the problems, the closer you get to the nose, more problems. But even there was a report someone had lip filler, blindness, chin filler, blindness, filler in the temples, blindness. And again, the reason is there's a rich network, a maze of blood vessels, and they're all interconnected. So you put a little bit of filler in one area, gets into the blood vessel, it travels to the orbit, and the eye is such that there's only one artery that goes into the eye. So if that artery is blocked, then it's not. Fortunately, I can treat it if they get to me early by dissolving the filler and injecting filler around the eyeball. And unfortunately, knock on wood, I haven't had to do that yet for anyone, but it can occur. Fillers, and just to show, are separate from what we call relaxers. Relaxers are Botox, Dysport, Chaboki. These are other brands. These are also injected, but these are considered drugs. These are chemicals that alter the nerve ending to the muscle that affects your forehead wrinkles, muscle jaw if you have tension. So those are relaxers, those are temporary, but they're injected like fillers, so some people get a little confused. What's Botox, what's a filler? Fillers are gels, they're implants, you see the result right away, but it settles over a week or two. Relaxers are drugs that affect and soften the muscle. Where do we put fillers? Now we'll see some more positive photos. Where do we put fillers? We put areas typically in blue. In the areas of blue, that's where we have volume loss. That's where we have tissue shrinkage because of age or sun exposure or lifestyle or whatever the case may be, genetics. The areas in yellow are areas where we gain fat or gain volume. So those, typically with surgery, will remove those fat. But areas in blue are the more common areas we're doing filler. So here's some example. Perioral. So this is a woman. Her smile lines are fine, but when she smiles, she doesn't like that they're too deep, so we use fillers to soften them. The lips are the most common area of filler, and the degree of change largely depends on how much we inject. And most patients, especially the ones that come to the office, we're doing a little bit. It's not much of a change. More subtle change that patients notice, but they don't draw attention. Chin. A majority of the patients I see for chin is primarily for surgery, where we'll put a silicone implant, but for those who are not ready for an implant, we'll do underneath the eye. So we lose fat underneath the eye, we gain fat within the eye, and then it creates a discrepancy of a hill and then a valley. So here we'll put fillers for those who are not ready for surgery to soften that appearance between the lower eyelid and the mid-face cheek area. Here's another woman. She had multiple eyelid surgeries by another physician, didn't want another eyelid surgery, so we put filler to soften this, decrease the depression around her eyes. This is a gentleman, part of his metabolism, he's a bodybuilder, weightlifter, he has a very high metabolism, eating a lot of calories a day. So as a result, he gets a lot of flat cheeks. So we put fillers in his cheeks just to soften. And so patients look more really revitalized, healthy. You don't try to make someone look younger with our treatments, just healthier. Here's a woman, we injected her temple. On the left photo, you see she has a depression. You can start to see the skeleton. And many patients don't like that appearance. It looks older. It looks sickly. So we soften that with the nose. Again, these are, the closer you get to the nose, the more dangerous it is potentially. That being said, we do a lot of non-surgical rhinoplasty with filler. He didn't like his bump. Put a little filler at the root of his nose to camouflage that bump. Here's a woman, she complained her nose was too flat. She wanted to build a bridge, so we build the bridge with filler. Again, it's a temporary implant, but for those who aren't ready for surgery, fillers are an option. So what if you don't want anything synthetic, but you don't want quite surgery? What are the options? Well, the other is fat, where we take fat from the abdomen, hips, and inject it. Or platelets. We draw your blood, we spin it, throw away the red blood cells, and inject the plasma and the platelets. And then, of course, surgery. This is a woman. She had fillers in another office. Just, again, was kind of tired of getting fillers, so we did fat transfer. And we put fat transfer, we kind of sprinkled it in multiple areas just to make her look fresher, just healthier, without making, she was a little, in my opinion, looked a little skeletonized on the left photo. Here's a young woman, and partly from genetics, she had a lot of hollowing around the eyes, dark grooves or dark circles, but also above her eyes. This is she was just born. So we put fat in her upper eyelid area, her lower eyelid area, and she also wanted a little bit in her lips and her cheeks and her temples as well. This is a facelift patient. She also had eyelid surgery, but she had fat transfer. She had fat transfer to the lower eyelid area and cheek to create a rounder face, more feminine face. Okay. And that's it. Thank you.
Thanks.
All right. So you want to do a little
Yeah.
Q&A and
Yeah.
we'll answer questions?
I have a question. How long does the natural fat transfer last?
So fat can be permanent. The big issue with fat is predictability. It's living tissue. We're taking it from your abdomen or your hips with gentle liposuction, not adding anything to it, and we inject it into the face. And your body then has to receive it and grow blood into that fat. And once it does, then it's your fat that will change with you. It will grow, it will shrink. So if you eat a lot of hamburgers, it's going to grow. If you don't, then it's going to shrink. So there is some variability in that. But generally, patients who have fat transfer, we're not doing it just like one area. We're sprinkling it in multiple areas to create a global softness without making, we're not making big cheeks. What are the questions? Yeah.
That was my question too. What's the average for the fat transfer?
Average in terms of.
How long does it last?
Well, I haven't had a patient tell me it's gone away. Some patients want more because they like the way they look, but they want, even more. So generally we'll wait at least, preferably 1 year before we consider doing another fat transfer because, there's still a little inflammation. After any procedure, even fat transfer surgery, it takes about a full year for final recovery. There's still a little microscopic level of inflammation there. So if we add more fat or do anything else during that time, it may not survive because there's a little bit of inflammation there. Yes?
Do you take the fat and then inject it in the same
Yes,
visit?
right away. Yes, same visit. Yeah, so some patients, if it's just fat alone, you could do it under awake local anesthesia, which is on your abdomen and your hips. But for those who are getting other surgery, then you're asleep under anesthesia. But we do it at the same visit. Yeah, we spin the fat, we filter, we take out any blood or oil from the fat. So it's just very small pieces of living fat that we inject. We inject it like filler. But most patients who get filler get maybe 1 or 2 bottles of filler and that's it. When we're injecting fat, we're injecting equivalent volume, 10 to 20 bottles of fat, 10 to 20 cc's or mLs of fat. When we're injecting filler, we're maybe putting 1 ml, 2 mLs, maybe 3 mLs. Yeah, so we're putting a lot more volume, but in the short term, it's not like really big puppy.
Yeah.
How long is that process?
The actual procedure, the numbing probably takes maybe 15, 30 minutes. And then the liposuction, maybe another 10, 15 minutes. Then the injection, that goes pretty quick. So the whole procedure, maybe an hour and a half.
Is there downtime?
I didn't show you, but it does. There's downtime. You're going to look a little puffy, a little swollen. But you can go to work the next day. It really depends on you. The only real limitation: no heavy lifting, straining exercise for a few days after the procedure. No makeup for that first day. Avoid contact lenses. But if you want to go to the office, if you want to do a Zoom call, if you want to take care of your kids, whatever, the light activity is fine.
How common is bruising? Sorry.
I was just going to say the same thing.
And I'm thinking more from just straight filler than from fat transfer.
From filler? Yeah, I haven't seen a bad bruise from filler. Yeah, it can occur, but you're going to get more bruising and swelling with fat transfer as compared with filler. Partly because we're injecting less volume, partly we're using a smaller cannula as compared to fat. And with fat, it takes a lot of kind of in and out to make sure the fat survives where we're putting it. Whereas filler, we don't have to go in and out as much, so there's less bruising and swelling. some patients go to work the same day with filler. For first-time patients, usually we'll say do it on a Friday, and then you have the weekend to recover, but there's not much recovery. But for filler, like with Botox, one day, like no heavy exercise, one day, no yoga where you put your head down, or contact lenses, or eyebrow grooming, just try not to touch the face for one day.
How do you? Oh, sorry.
Yeah.
As like an as a plastic surgeon, I would think you have a high sense of aesthetics along with everything else you do, your professionalism and your actual physical work. How do you create a balance for? I mean, I'm going to be 60. You can't fix everything. So
Right.
how do you not make it look like a Barbie doll on top?
We have a conversation.
Yeah.
So, what is your chief concern? And then the question I always tell patients is, if I saw this photo, right? If I saw this photo, what's the first thing I would do? Right? What's the first thing you would do? Think about it. What's the first thing you're doing?
Eyes.
Probably the eyes. Yeah. Or maybe the skin. Right? That's probably one. Right?
Did you do a neck lift on her?
Yeah, she had a facelift. Yeah, she had a facelift too.
Do you do laser?
Laser, I don't do. Yeah, that usually I defer to dermatologists. So we'll do a chemical peel, a deeper one. It's a little, not more superficial one. So she had a deeper one while she was asleep for her facelift.
Was there phenol? What?
Not the phenol, not the phenol. I use a 35% TCA. And sometimes I'll use 50% TCA, but that's more for specific areas.
Do you recommend lymphatic drainage afterwards?
It's great. Yeah, absolutely. So the one issue with surgery or even injections, fluid can get stuck here. And any massage of the neck or the chest helps kind of milk it out. So I defer to patients if they already have someone that they go to massage, or themselves or their significant others to help massage.
So for those who don't know, but Erica is an amazing massage therapist and she does lymphatic massage. And so Erica, would you say that, and Dr. Chaboki too, if somebody is coming in for, let's say, fat injections or even a facelift, would it be a good idea to have a lymphatic massage before the surgery so that the healing is faster?
In my opinion, I would do it before.
Yeah.
And the afterwards, let's say if they had fat transfer, I would avoid the area with the fat transfer in order to maintain the fat in the area the doctor applied. So we can go in different areas.
Yes.
But every doctor has different protocols.
Yeah.
So we always ask the patient, what's your doctor recommendation?
Right. Yeah.
Because every surgeon has different timeline. So we kind to follow, the recommendations.
Yeah, generally speaking, before surgery, that's fine. I wouldn't do it the day before surgery, but a week before. Afterward, it depends on the procedure. So if I'm doing a face and neck lift, then I generally don't advise massaging that area for at least a couple of weeks afterward. If it's a fat transfer, we're doing fat transfer here. Neck massage is fine. Okay. And that could occur the next day. So it depends on the procedure and the patient. So some patients have a shorter recovery period. The other thing I tell patients, let's say you have twin, you do the same procedure on both patients. One may heal a little differently than the other.
Yeah. During your consultations, do you and let's say the patient wants filler.
Yeah.
Do you, in what case would you say, oh, I would do fat transplant versus filler here? Are there certain areas or certain situations where you would recommend one over the other? And by the way, do you want to sit down?
Sure, yeah. Sure.
I mean, you're not going to be on your tape.
Yeah, that's fine. We can sit.